Well, here to answer some COVID questions is Dr. Alyssa Wuerzel, an infectious disease specialist at Tufts Medical Center. Thank you so much for joining us.
Yeah, great. Happy to be here.
Yeah, okay, so this new statistic is sobering. It's sad to hear. COVID was the third leading cause of death for Americans in 2020. Is it likely to rank just as high at the end of this year?
Well, I think it was third to malignant neoplasm, meaning cancer, and cardiovascular disease or heart disease. And I'm not sure where it's going to rank out. Even in the setting of COVID, so many people delayed getting care for those other things. So the effects of COVID are not just COVID deaths, but delaying the necessary care that people needed for those other illnesses. So I'm not sure where it's going to end up in the list.
Dr. Wuerzel, we mentioned the numbers at the beginning, 660,000 deaths from COVID-19. We hear every day and we report every day about the impact on individual families. Let me boil it down to you. You've been on the front line. So what's been the toll on you and your colleagues?
I mean, I think we all try to show up each day with the same amount of empathy and the same amount of willingness and readiness to take care of whoever walks in through the door. It is hard emotionally now that we have a vaccine that can prevent illness to take care, to wrap your head around this idea that this person is very sick and needs to be intubated and this could be prevented. So I think it is hard. I went into medicine because it's hard, so it's not going to stop me from being a doctor. It's just challenging to see people suffer from something that could be prevented.
Yeah, I can only imagine. Got to ask you this. Is there a single comorbidity that most victims have in common here? Is there an age that's still the most important factor?
I would say comorbidity, no, it's the same kind of diabetes, obesity, cardiovascular disease, heart disease. I would say an older person who's vaccinated is protected against the virus in a way that a younger person who's unvaccinated is not. So what we used to talk about with people who are older succumbing to more severe disease and death, now that you throw vaccine into it, it feels like it's evening things out a little bit. And so, older people who are vaccinated, and I'm on service in the hospital right now, and so older people who are vaccinated fare quite well with this disease, and younger people or anyone who's not vaccinated sometimes have a hard time with it, and it's really challenging to watch this happen.
So may I ask you, where's the line for what's an older person? 60 and older, 50 and older, 65 and older, 80 and older? What's an older person?
I said that, and then I heard of my parents being like,
right,
questioning it. I think for the purposes of COVID, I kind of think of 55, although I'm 43, so maybe, I think everyone thinks of that
55
differently.
55 doesn't seem old to me,
No.
but whatever. Okay, so I want to put a graphic on the screen. I don't know if you can see it, but Massachusetts, I'll tell you what it says. Massachusetts has seen more than 18,000 confirmed COVID deaths since the start of the pandemic, and the majority were in Middlesex County. So, but how does this data compare to other states in the union?
I think every state in the union has experienced their own death toll in different times. So the biggest push in Massachusetts was back in March to April. So if you compared Massachusetts in March to May or March to June of 2020 to, say, Texas, it would have been a different death toll to what it is now. So it is very hard to compare it. Right now in Massachusetts, because most of our hospitals are not overwhelmed with COVID, we're in a good position to provide as best highest level quality care, where I think other places are struggling. They're trying as hard as possible, but they're overwhelmed.
Yeah. Dr. Wuerzel, it's great to see you. Thank you for your time.
Thank you.
Take care. Bye-bye.